Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog post focusing on evidence-based but non-conventional therapies for bone health. Let me begin by saying there are a couple of FDA-approved or conventional bone health therapies. A class of drugs called bisphosphonates, very difficult to say, and another class of drugs, I'm blanking, denosumab. Chances are your oncologist will prescribe one or two of those depending on your cancer. Sometimes the cancer itself can damage bones, sometimes chemotherapy can damage bones, sometimes inactivity can weaken bones. In general, many cancer patients are older and might not have strong bones. And many cancers metastasize or spread to the bones, so bone health is critical for all of us from a number of different perspectives. So while most of our time and focus is on drugs to kill our cancers, and that's important, but in addition, bone health is also important. Maintaining strong, healthy bones, very important. So that's what this blog post, if you scroll down and click through, is all about. And these are those evidence-based but non-conventional bone health therapies. So, and it's important to remember, denosumab and bisphosphonates are important, are effective, but there are side effects oftentimes, and this is pretty well documented, that the risk increases over time. Osteonecrosis of the jaw. There are a number of possible side effects. So it's in your interest as a patient, survivor, to understand the pros and cons, risks and benefits of any therapy and apply that to your specific therapy plan. So after I underwent the bisphosphonates for about a year, I think, when I was undergoing a bunch of different therapies, conventional therapies, I then went off bisphosphonates and underwent my own bone health therapies, exercise, nutrition, green leafy vegetables, certain nutritional supplements have been shown to help with bone health, not just calcium, but vitamin D. So the blog post linked below will explain those evidence-based but non-conventional bone health therapies. If you have any questions or comments, and for the record, I do those therapies to this day. I think daily exercise is important for us for a number of different reasons. In this case, the case of this blog post is to talk about bone health. So simply walking, swimming, muscles, pulling on the bones, that strengthens our bones. That's great, especially as we age. So if you have any questions or comments, be sure to click through, ask a question. Thank you for your time, and hang in there.